Hi, Dr. Tammy Penhollow from Precision Regenerative Medicine in Scottsdale, Arizona. Today we're talking about neck pain and how regenerative medicine may be a great solution for your neck pain. Oftentimes, people get neck pain as a result of simple wear and tear or aging. It develops a degenerative disc disease and degenerative joint disease, fancy term for arthritis, osteoarthritis of the neck. It can result in stiffness, pain that radiates up into the head, sometimes down into the shoulders, between the shoulder blades, and occasionally even down into the arms. It can also occur from a motor vehicle accident or some form of a whiplash injury where the muscles are tightened, and it can cause some wear and tear on the ligaments or even stressing of the ligaments, hyperextension, which is this kind of a motion in a whiplash fashion, and then the muscles, tendons, ligaments, and overlying tissues are angry and create a pain cycle. Neck pain can also come from prior trauma that is not whiplash generated, such as a fall onto your head. Sometimes even if you fall on your hand and outstretch that, or a stretching injury. Think of somebody like who's riding a bronco or riding a bull, but their arm is up and they're extended down here. It creates an injury all the way into the neck. Degenerative disc disease can be the wear and tear, or you can get degeneration from trauma. If you have an acute herniation of the disc and eventually that disc semi-heals, it can still create some pain down into the arm. There are very specific motions that can recreate that pain, and there are tests that we do as well as get MRIs of the neck so that we can know what type of involvement is affecting the person specifically. So in neck particularly, we definitely need an MRI, one preferably that is less than or equal to 12 months old, because things can change over time. For example, a herniated disc can resorb over time simply by resting, doing physical therapy, and other conservative measures. Traditional therapy often requires doing things like epidural steroid injections to maybe go around and put some steroid to shrink the swelling around that disc. Steroid does not shrink the disc itself. It cannot. It simply takes time, or perhaps doing some regenerative therapy into the area, and that's what we're talking about today. PRP, platelet-rich plasma, which is drawing your own blood, putting it into a centrifuge and processing it, getting the red cells out and super concentrating the growth factors and anti-inflammatory mediators, placing those expertly guided using a C-shaped X-ray called the fluoroscope into the ligaments that are between the spinous processes. Here's the spine, there's ligaments right here, there's ligaments as you go deeper, and then this is the disc area. So placing the PRP into the ligaments, into the joints that are between each of the vertebrae of the neck, into the epidural space to bathe the area with your body's own anti-inflammatory cytokines and growth factors, and then into the muscles on the outside. It's kind of like you work from the inside out. You can then allow the body to heal itself without the destruction of radiofrequency ablation, without the destruction of fusion with either your own bone, cadaver bone, hardware, plates and screws, and without the destruction that comes from using corticosteroids. This entails getting a really good history, doing a physical examination that is consisted of strength, reflexes, sensations, so a musculoskeletal and a neuro exam, and reviewing a recent MRI so that we can discuss whether or not PRP, or bone marrow aspirate concentrate, is right for you to relieve your neck pain, to increase your range of motion of your neck, to decrease headaches, to decrease visual changes, to decrease weakness down into the arms, and to improve your posture because the muscles aren't overstretched and over-tightened. If you'd like to discuss this further, please give me a call, Precision Regenerative Medicine in Scottsdale, Arizona, or visit us on the web, https://precisionmedprp.com. Thank you.